Everybody, I am Dr. Armen, Professor Armen Astvatsatryan from Yerevan, Armenia. So you are on the Dr. Y channel. My dear students, we continue to talk about your big exams questions, and today we will talk about good. I find a question like dysbiosis and dysbacteriosis. My friend, dysbiosis and dysbacteriosis, this is a classic term that we used to use in epoch of USSR. Actually good term, but it's nothing for you, for your ears. Huh? So I give you another name, most common name, resembling this condition in international classification of disease classifications. So we will talk about irritable bowel syndrome. So actually today's topic is irritable bowel syndrome. So dysbiosis, dysbacteriosis, microbiota problems, all is this resembling irritable bowel syndrome. Okay, so what's irritable bowel syndrome? Irritable bowel syndrome is characterized by recurrent abdominal discomfort or pain with at least two of the following characteristics: relation to the defecation, association with a change in frequency of stool, or association with a change of consistency of stool. Actually, the cause is not known and the pathophysiology is not fully understood. Diagnosis is clinical, treatment symptomatic, consisting of dietary management and drugs, including anticholinergic drugs and agents active at serotonin receptors, antidepressants. Okay, I understand that this definition is not well. I don't like it either, but anyway, this is characteristic of irritable bowel syndrome. So irritable bowel syndrome is a condition that's characterized by recurrent abdominal discomfort or pain with relation to defecation in association with a change in the frequency and consistency of stool. So actually, answer like this is quite correct. I understand everything is clear for me, and I understand in your position that you are in something in misunderstanding position. Yes, I understand that, but anyway, if you answer in this manner, is largely sufficient. So actually, you have to find in my lectures in this channel about irritable bowel syndrome. So I see continuing of these questions. Let's answer all these questions. So etiology of dysbiosis or dysbacteriosis is the etiology of IBS. IBS, it's a irritable bowel syndrome. So that, once again, the exact cause of IBS is irritable bowel syndrome, is not fully understood. But several factors we know have been identified as a potential triggers or contributors, if you want, to development of this condition. Abnormalities in the gut-brain axis. Gut-brain axis. The gut and the brain, now we know that, are closely connected through the nervous system, and abnormalities in this connection may lead to IBS symptoms. Abnormalities in gut motility. These muscles in the walls of the intestine that contract to move food through peristaltics, through the digestive system, may contract too strongly or vice versa, too weakly in people with IBS, leading to symptoms such as abdominal pain, constipation, diarrhea, etc., gas, etc. Now gut inflammation. Low-grade inflammation in the gut may contribute to the development of IBS symptoms. Changes in gut microbiota. Actually, changes in gut microbiota, this is a synonym of dysbiosis of intestines. So imbalances in the types and amounts of bacteria in the gut may contribute to development of IBS symptoms. Some food sensitives also. So actually, this is one of the part of diagnosis. Food sensitivities. Certain foods may trigger IBS symptoms in some people. And actually, very, very interesting that in some people, sometimes the cake trigger IBS, sometimes not. The same people, the same person. Stress and anxiety. Emotional stress and anxiety may exacerbate IBS symptoms. Actually, I want to be honest with you. Me also, I've got this problem. So I know that for certain. Huh? So it's important to know that IBS is a complex condition, my dear students, and the exact cause and contributing factors may vary from person to person. So, my dear friends, take pens and papers. Don't just look at me. Huh? Write, make the notes. Re-listening this video. So clinics, clinics actually it's a symptoms and signs. No, you know that. The ancient tradition, clinics means symptoms and signs. The symptoms and signs of IBS, irritable bowel syndrome, can vary from person to person, as we said above, mentioned above, but some common ones include abdominal pain or discomfort. Actually, the most cause. This is often described as cramping and may be relieved by having a bowel movement. Yes. Changes in bowel movements. This may include diarrhea, constipation, or a combination of both. Some people with IBS may experience urgency to have a bowel movement or a feeling of incompetence evacuation, of incomplete, evacuation, incomplete evacuation. Bloating or swelling of the abdomen. This can make the stomach feel full and tight. Excess gas. This may be accompanied by belching, or flatulence. Mucus in the stool. Some people with IBS may notice mucus in their stool. Actually, it's not a huge problem. Mucus in the stool. If it's not without blood, of course. Obviously, if it's with blood, it's severe a problem. Nausea and vomiting. These symptoms may occur in some people with IBS, especially during times of increased stress or anxiety, as a flare of the disease. It's important to note that these symptoms may come and go over time, and they may be mild up to severe. Diagnosis. Okay. So, diagnosis of irritable bowel syndrome, abdominal pain, clinically, abdominal pain or discomfort. This is relieved by having a bowel movement and or a change in the frequency or appearance of bowel movements. Symptoms that have been present for at least 6 months and that occur at least 3 times per month. Symptoms that are not explained by another underlying medical condition. So, my friends, it's okay, but we have to understand one principal moment. Diagnostic so-called red flags. We have to know that. Diagnostic testing should be more intensive when the following red flags are present, either at an initial presentation or at any time after diagnosis. Older age, weight loss. Once again, write it please. Older age, weight loss, rectal bleeding, iron deficiency, anemia, family history of colon cancer, inflammatory bowel disease, celiac disease, and nocturnal diarrhea. Re-listening this video, yeah. Good. Differential diagnosis. Because patients with IBS can develop organic conditions, testing for other conditions should also be considered in patients who have red flags or develop markedly different symptoms during the course of IBS. Common illness that may be confused with IBS, lactose intolerance, I very often going with lactose intolerance, drug-induced diarrhea, post-cholecystectomy syndrome, or cholecystectomy syndrome, after, girls, post-cholecystectomy syndrome, laxative abuse, parasitic disease, for example, giardiasis, eosinophil gastritis or enteritis, microscopic colitis, small intestinal bacterial overgrowth, celiac disease, bile acid diarrhea, and early inflammatory bowel disease. However, my friends, in uninflamed, you have to remember that uninflamed without inflammation, colon diverticular, from previous lecture, do not cause symptoms, and their presence shouldn't be considered explanatory. That is, this is a so-called diverticulitis at all. Uninflamed if there is no inflammation. That's a good question, it's inflammation or not. But it's another question, another topic. So the treatment of IBS, yes, International Box League, Irritable Bowel Syndrome, focuses on managing symptoms and improving quality of life. Of course, we have no single management treatment that works for everyone with IBS. So we have to work with each person to develop an individualized treatment, if you want, planned based on a patient's specific symptoms and needs. But of course, we have principal rules that are common. Dietary changes. Certain foods or food groups may trigger IBS symptoms in some people, so dietary changes may be highly recommended. This may include avoiding certain foods or increasing fiber intake. Some medications. Yes, we know that several types of medications may be used to manage IBS symptoms, including antispasmodics to reduce abdominal pain, laxative to treat constipation, and antidepressant, it depends, to improve mood and reduce pain. But they have another problem with these medicals that have severe side effects, antidepressants. So I do, no, it's out of the topic, of course, but starts with the phytotherapy, which works greatly. Stress reduction. Stress and anxiety can exacerbate IBS symptoms. So stress reduction techniques like intimate relationship with girl, of course, intimate relationship. But meditation, yoga, physical activities, sports, why not? Some relaxation techniques were highly helpful. Probiotics and prebiotics. Probiotics are beneficial bacteria. There are a lot. We can find in any country. There's different names of probiotics. For example, in Armenia, it's narine, very famous. So probiotics are beneficial bacteria that can help restore balance to gut microbiota, and they may be helpful for some people with IBS. Actually, good advice after any diarrhea. Good advice to my patients. I do this. Take one capsule of probiotics. Doesn't matter what is the cause. Just in case. After any diarrhea, so stool problems, diarrhea problems, take one capsule of probiotics. And finally, behavioral therapies. Certain behavioral therapies, such as cognitive behavioral therapy or hypnotherapy, may be helpful for managing IBS symptoms in some people. But actually, all you need is love. Love is all you need. So, no, of course, you don't answer in this manner, but actually, this is the first and principal remedy. Medical management therapy. Love. Okay, thanks, my friends, for your attention. See you in other lectures. Don't forget to re-listen these videos several times. See you in other lectures. My friends, don't forget to follow and subscribe the channel, Dr. Y channel. See you, and God bless you. Bye, 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 bye.